This short session will be looking at the BMJ Best Practice Clinical Decision Support Tool. At the end of the session, you'll be able to access BMJ Best Practice, have an overview of the key features, find treatment and management options for particular conditions, use the inbuilt Comorbidities tool to tailor the treatment plan to your patient, download the BMJ Best Practice app to your phone or device, and know how to use BMJ Best Practice to accumulate CPD or CME credits. BMJ Best Practice is a comprehensive and evidence-based point-of-care clinical decision support tool. It offers step-by-step guidance on diagnosis, prognosis, treatment and prevention, and is ranked one of the best clinical decision support tools for health professionals worldwide. It's a research and reference resource that a clinician can utilise immediately at the point of care with a patient and enables the clinician to find answers fast using a user-friendly layout that mirrors the patient consultation. To access BMJ Best Practice, go to this URL or type BMJ Best Practice homepage into your search engine. Click where it says Your Profile at the top right of the screen. If you click on Set up your free user profile, you'll be able to follow some simple on-screen instructions to create a BMJ Best Practice account. Alternatively, you can use an existing Open Athens password to log in. Click where it says Login with existing profile as shown here. If you've created a BMJ Best Practice account, click where it says Login as shown on the left, then enter your email address and password as prompted. Alternatively, to log in with Open Athens, click Access through Institution as shown on the bottom right of the screen. This screen will come up where you can click on Login via Open Athens or Shibboleth. This pop-up window will then appear. From here you'll need to select NHS in England as your institution. The first time you do it, you'll need to use the search box to search for it. On subsequent occasions it will appear in the list of options. A second pop-up window will appear asking you for your Open Athens username and password, which will then log you in to the BMJ Best Practice homepage. If you don't already have an Open Athens login and password but would like to create one, you can go to this URL or type Open Athens registration into your search engine. This will bring up an online form where you'll be asked to enter your organisation as one of the questions. For Nottingham and Notts primary care staff, you'll need to select GPs, practice staff and ICB staff in Nottingham City and Nottinghamshire County. Fill in the rest of the details and click Submit. You'll then receive an activation email. Click on the link in the email to create your password. From the BMJ Best Practice homepage, you can browse by specialties. You have access to 500 medical calculators. You can download patient information leaflets to give out during consultations. You have access to short video animations explaining how to perform common practical procedures, or you can listen to a podcast. You can also use BMJ Best Practice to help you stay current by following the listed important updates or browse under What's New. If you select the What's New tab, there will be an option to select clinical updates, then updates by specialty. You'll find primary care listed as one of the specialties as shown here on the right of the screen. Most of the time though, you're likely to use BMJ Best Practice beginning with a search. For an example search, I'm going to type asthma into the search box, then select asthma in adults from the drop-down list. The information that appears is highly structured to follow the path of a patient consultation. There's a useful summary. Under diagnosis, the links include investigations and differentials. Under resources, there are links to the relevant guidelines, patient information leaflets and videos, amongst other things. Under management, there's a link to the all-important treatment algorithm. The treatment algorithm guides you through the treatment options step by step. If you choose your patient group by clicking on it, for example, if your patient has infrequent symptoms, the first line treatment will appear as shown here on the right hand side of the screen in a succinct format and so on. If you scroll down the screen, you'll find prescription guidance. You can check the prescription guidance by clicking on it and it will link you to the appropriate section of the BNF. Certain conditions include an inbuilt comorbidities tool. This takes account of a patient's acute condition alongside their existing comorbidities, and the result is a tailored treatment plan designed to treat the patient based on evidence and expert opinion. A search for COPD, acute exacerbation for example, brings up the screen shown here. The treatment algorithm under management shows the pink C comorbidities symbol, meaning it has been included for this condition. If you select the treatment algorithm, you'll be prompted to select the patient's existing conditions using the tick boxes as shown in the lower half of the screen here. If you scroll down to the treatment algorithm, look out for the comorbidities icon for treatment options that are affected or added as a result of your patient's comorbidities. When you select the treatment option with the C, the tailored treatment is highlighted as shown here, in this case managing the patient's diabetes when they're taking corticosteroids. If you scroll down further, it indicates drug choice, dose and interactions may be affected by this patient's comorbidity. BMJ Best Practice is also available as an app, allowing online and offline access from anywhere. You'll need to register for an Open Athens password first, then download the app from your app store, which will take about 5 minutes. You'll then have offline access. If you use the app offline often, it's best to remember to download any updates regularly. The app includes a browse bar for quick access to important updates, specialties and more. Topics are broken down into clear sections, including diagnosis, management and follow-up. Procedural videos and images are included for relevant conditions. The interactive medical calculators are also included on the app, as is automatic tracking of your activity for CME and CPD purposes. This slide gives a few screenshots to show how it looks using the app on an Android phone. All the time you spend reading topics and finding clinical answers on BMJ Best Practice is automatically logged and converted into CPD credits. This will happen if you're logged in with a BMJ Best Practice account or with an Open Athens account on both the desktop version or the app. BMJ Best Practice gives you 0.25 credits for every 15 minutes spent on the website or app. You can then create certificates to claim CPD credits. To create certificates, you simply select the activity you want to be included and add reflection and impact statements as required, then click on Save and Download to save a certificate to your account. Thank you very much for your time.